Okay, welcome my friends to the Bob and Brad podcast, produced by Bob and Brad, the two most famous physical therapists on the internet, in our opinion. I am Bob. I am one half of the Bob and Brad team. And our guest today is a physical therapist and co-owner of Entropy Physiotherapy and Wellness in Chicago, Illinois. If you're in the area, stop by. Her area of interest is in treating the spine and pelvis with a specialization in women's and men's health. In 2008, she received her Doctorate of Physical Therapy and Master of Science degree in Women's Health from Rosalind Franklin University and was awarded a board certification as a women's health clinical specialist in 2009. She's a busy lady. She has completed a certification in mechanical diagnosis therapy from the McKenzie Institute, which is excellent. Brad and I have done that ourselves, and is a registered yoga teacher. She is passionate about learning more about the human body in order to provide efficient and compassionate care as she helps patients return to optimal functioning. I want to introduce you to our guest today, Sarah Haag. Hi,
Hello,
Sarah.
thank you for having me.
Yeah, thanks for coming. I like I said, I've read your book. I'm going to go ahead and mention that right away. Understanding and Treating Incontinence, what causes urinary incontinence and how to regain bladder control. So I read it actually a couple months ago, and I've been doing it. I've been doing the Kegels exercise, and this is a little bit embarrassing, but it's helped me with hemorrhoids, and it also I was getting up twice a night. Now I'm down to one. So
That's fantastic.
yeah, it's really, I know that's one of my questions actually is how long before they tend to help, but we'll get to that later. So
Sounds good.
can we just jump right in here?
Yeah, let's jump in.
Do you think we can talk about diastasis recti or
Sure, if you'd like to.
why don't we start that right now? Why don't you
Okay.
define diastasis recti? Am I saying it right?
Yeah, so some people say diastasis rectus abdominis. There's a lot of different ways to say it, but most people will call it like the gap in their belly. If we think about our six-pack muscles, and I'm dating myself a little bit because the example I always give is like Arnold Schwarzenegger, like in Terminator days, not Governor days. But right, so in a six-pack, we see that little divot in the middle dividing the two three-packs. And so that's our linea alba and where our two rectus abdominis muscles come together. Now, very frequently during pregnancy, and by frequently, I mean some studies show that 100% of women will experience a diastasis of some sort during their pregnancy.
Wow.
And so this isn't a rupture of the muscles. And there's actually a lot of great discussion right now as if this is even a pathology, because I mean, if we think about what would happen if those muscles didn't stretch that connective tissue between those muscles didn't stretch, I don't know what would happen. And then, it's important to remember a lot of women get better after that. So a lot of women do fine. I will say there's a lot of, I don't want to say mystery, but a lot of varying ideas around diastasis and how it should be treated, if it should be treated, and best approach. And there is, thankfully, if we look at the evidence, some pretty straightforward things to try, understanding that some women will need more help than others. I might be getting a little ahead of you, but yeah, so basically, yes, for the definition, basically it's that separation where then there's kind of a gap between those two halves of our six-pack muscles.
Sure. And I know a lot of sites talk about, and again, I have no experience with this whatsoever. I never treated it. One of the signs isn't that you can actually, do you want to tell how to do it?
Yeah. So the one, I mean, certainly the way I was trained to test it is to just have a woman lie on her back. And quick side note, men do experience this as well. They don't seek out help very often. And also there's not tons of research. There are a couple people starting to look at it. But it's definitely, I would say, predominantly looked at as a female issue, especially postpartum. But you would lie on your back with your knees bent, and then you would just do a crunch, and you can actually kind of feel around in the midline and see, can I feel a distance between those two halves? In the last, it's probably been 3 or 4 years now, Paul Hodges and Diane Lee did a paper together looking at, are we more interested in getting those spaces closer together, or do we just want to make sure that it's firm between those two areas? So for some women, and again, I'd say this is at the end of the spectrum, right? So this is not most women. You know, the diastasis stays pulled apart, and it's very soft. So even when they try to create tension in their abdominal wall, they're not able to. So that then there's a lot of different thoughts and opinions as to what to do about that. But many women do really great with just restarting an exercise program they enjoy. Because really there's not evidence that a particular exercise will make it worse. So for any woman who's read anything that they're scared to do but would like to do but was told it would make things worse, we don't have any evidence to support that. There's also not any evidence that any one particular activity or approach will help them get better sooner. So I like to tell PTs, we can't fix this. We can't say we're
That's
going to
what I
make your
saw in
gap
the
smaller.
research. I saw in the research too, but it doesn't stop. I've seen articles saying you shouldn't be doing these exercises, and I've seen articles you should be doing these exercises. So that just no proof at this point.
There just isn't. There is some evidence that shows being more active versus not active at all is helpful, which actually, like, I'm good with that kind of a statement, because if I never work on my abs and they look a certain way and then I worked on my abs, they're probably going to change. So, I mean, that just makes good sense that doing nothing for fear of making it worse isn't helpful for a lot of reasons. But, you know, I've met women 5 years after their last baby who still won't reach over their head because they were told stretching their abs would make their diastasis worse. So yeah, so we need to not scare people, encourage them to get moving, but then there are probably people who are better at helping people regain the function that they want and the appearance that they want. And you can find those too. Mostly they're women's health therapists.
So you really can't prevent this, correct?
I haven't seen any evidence that would prevent it. I think there's we can say safely there's like a genetic component. You know, like what's your connective tissue like, and how well does it recover? But yeah, I would say that there's being strong, like being generally healthy would make your connective tissue healthier.
Sure.
So that's what I would probably focus on.
So are there any health implications or complications associated with it?
Great question. We haven't found any. So we used to think it might be associated with back pain, pelvic organ prolapse, incontinence, but really recent studies are showing that women might have both, but we're not finding a correlation or even an increased prevalence. You know, that women with a diastasis, actually there was one study where women without a diastasis actually had more incidence of incontinence than women who did have a diastasis. So then you kind of wonder, like, well, thank goodness for the diastasis that maybe managed something better. I don't know. So I think there's a lot we don't know, but I like to embrace like the strength and resilience of the human body and the adaptability of the human body. That I don't think it's I really think that we should step away from calling it like a pathology or a dysfunction.
Sure.
There are cases where it is, but most of the time it's just something that women can recover from, as long as we don't scare them into not recovering from it.
So I think you've answered this question already in a sense. I imagine you wouldn't recommend wearing an abdominal binder then.
No, most of it. So there's no evidence that shows an abdominal binder will help prevent or reduce a diastasis. Where a binder might come in handy is if a woman feels like she's having trouble creating that tension, which, I mean, as you can imagine, that imagine a woman at full term, how stretched her abs are, and then the baby comes out, her abs are still that stretched. It's going to be hard to create that tension. So if, you know, getting a binder that feels like a lovely hug in the middle can help people feel better and have them feel like they can do more. Huge fan of that. But again, as far as like reducing anything, any particular claims, not so much. So I recommend, like, women should do what feels good and get moving.
I love that you went over this subject because again, it counters just about everything I read. So, except for when I read research, and in what you're saying supports the research, and the research supports you. So,
Yeah.
I'm glad with
Well,
that.
I do think the research, because I wouldn't have known, right? Like, I mean, I want to know what's most likely to help. And there are definitely, I always wonder if it's like taking advantage of a vulnerable population. There's a lot of kits and programs that claim
Yes,
things.
yes,
And again, there can be benefits to having a program that walks you through getting more active, but that's the magic. It's
sure.
not the one particular exercise that you did a particular way. At least we don't have proof for that yet, but we do know if you get moving and stick with it, and stay active, it can be helpful.
Thank you very much. So I think we're going to cut off here. I want to again mention your book for urinary incontinence, Understanding and Treating Incontinence, what causes urinary incontinence and how to regain bladder control. Also want to mention they can find you on Twitter at Sarah Haag, SARAHHAAGPT. And then she has a website for your clinic, correct?
For the
Uh,
clinic, yep.
Entrepreneur, I keep saying this wrong. Entropy.physio.com.
Correct.
No, just
Nope, just that physio.
entropy.physio. ENTROPY dot PHYSIO. Proven I can
Mhm.
spell it a little bit. Anything else, Sarah? You're in Chicago. If people want to look you up, and they certainly can
Yeah,
on Twitter.
absolutely. I mean, at Twitter, I'm there quite frequently. I mean, Chicago, I live there. Come in the summer when it's nicer and everyone can be outside and safely distanced.
That sounds great. Well, thank you again for taking the time to be on our show. And I hope we can have you in the future and talk about some men's health then.
That would be great. I feel like men are super underrepresented in pelvic health, so I'd love to have that opportunity.
Awesome.